Hi, Dr. John Torres here with this Daily Doctor, where every week, twice a week as a matter of fact, I cover headlines, and in those headlines I give you some information that's behind the headline, a little deeper knowledge of what that headline actually means, and particularly what it means for you. And the hope here is that I give you information that you, your family, your loved ones, your community can use to get through this pandemic sooner rather than later, and as I always say, as healthy and as happy as possible. And on top of that, I answer questions you have. So if you have questions, please send them our way, because they're usually great questions. I'd love to answer them, because oftentimes there are a lot of things that I don't think about or other experts don't think about, but they're questions that you have, and that's important to get those answered. But let me cover the headlines first. First and foremost, I want to talk about vaccines and where we are with vaccines right now. So if you look at the CDC tracker for vaccines, and they have the most up-to-date information, to date we have given 118 million vaccines in this country. Now, President Biden, when he came into office January 20th, he said in his first 100 days he wanted to get 100 shots in arms. 100 days from January 20th would be the end of April. And so the 100 million shot, I said 100, but I meant 100 million shots in arms was actually done yesterday, maybe today time frame. It's right around here where we're going to get that 100th million shot in the arm during his first 100 days in the office. That's 40 days ahead of time. So that's fantastic. Right now we're averaging over 2 million shots a day in this country. And so that puts us in pretty good areas as far, and they're working on getting that done as well. The reservations, the Indian reservations themselves are doing a very good job of getting people vaccinated. As a matter of fact, they're one of the examples of how they are doing things correctly, which is fantastic. And that's both either through the IHS, the Indian Health Service, or through their own states getting the vaccines to them. But what they're showing is the important part here is getting those vaccines and that knowledge of the vaccines down to the community level, particularly community leaders who can then educate people in their community. They're hearing from somebody they trust about why they should get the vaccine, which goes a long ways towards getting through that mistrust that is inherent here because of things that have happened over the last multiple decades in the United States, especially with the American Indians, the Alaskan Natives, African Americans, Latinos, the issues they've had and the distrust that that's caused in the healthcare system. So getting around that, or getting through that by using community leaders, educating them as to why the vaccine is important, goes a long way towards people accepting the vaccine, which is going to be important to get that towards that herd immunity. And speaking of herd immunity, so right now, if you look at the numbers, again, 118 million vaccines. Of those, 41 million, almost 42 million have gotten fully vaccinated, which means they either got 2 doses of Pfizer or Moderna, or they got the 1 dose of Johnson & Johnson. Looking at the numbers, though, that's 12.6% of the population. By most standards, we need 70 to 85% of the population immunized to reach herd immunity. If you break it down a little bit, those over the age of 65, right around 40% of those are fully vaccinated. So not quite half, but getting close to half being fully vaccinated. Now, we are starting to see numbers in this country down to 50,000 a day in that area, between 50 and 60,000 a day. Unfortunately, those numbers have plateaued a bit. They haven't dropped down to that level of 20 or 10,000 that we'd really like, but they also haven't really risen dramatically. There's some areas where they're starting to see cases go up, and we're concerned that with states reopening over the next couple of weeks, we're going to see cases rise again. And as we always talk about, cases, hospitalizations, and deaths follow in 2-week increments. But the fact that more and more people are vaccinated is going to help, but it's certainly not something that they're looking at right now because, again, we're not close to that herd immunity, which is where we need to be. And so the more people get vaccinated, the sooner we vaccinate people, the sooner that's going to happen. The other thing is that it looks like we're going to have 700 million vaccines by the end of summer, or at least partially through the summer, which is great because that's more vaccines than we need to vaccinate the entire population of the U.S., which is fantastic. Right now, 16 and above can get vaccinated. The pharmaceutical companies, Pfizer, Moderna, and Johnson & Johnson, are all looking at vaccinating children, so they're doing human trials right now. And what I frequently talk about is the reason they're delaying the human trials on kids is because they want to make sure it's healthy in adults first, safe and effective, which has been proven. And so now they're going to look at kids. They're testing them on older kids right now, the 12 to 17-year-olds. Then they're going to start testing them on 5 to 12-year-olds, and then 2 to 5-year-olds, and then under 2 down to 6-month-olds they're even going to test. The current thinking is 12 to 17-year-olds will be able to get their vaccines this summer in time to be fully vaccinated by the time school reopens in the fall, which is going to be fantastic because the CDC did come out with some guidelines. We'll talk about those in a minute. But as the younger vaccinated, and so we're getting there, but at the same time, it's one of those things that's going to take a little bit longer, although we are making great strides right now. But remember, the vaccine is just one of the tools we have to get us through this pandemic. It's not the only tool, and it's certainly going to help, but it's only one of the tools. And I'll talk a little bit about, again, what's happening with the CDC and their new recommendations. The other vaccine you might have heard about is the AstraZeneca vaccine and the blood clot issue. And the EMA, which is basically the European equivalent of our FDA, it's a European Medicines Agency, they put a pause on 37 reports of blood clots in people following the vaccines. Doesn't appear to be a correlation between the two. One doesn't appear to cause the other one. The vaccines don't appear to cause the blood clots. Instead, it looks like these blood clots are happening like they would in a normal population to begin with. Example, here in the United States, in an average year, 600,000 plus people have blood clots of different varieties. But 600,000 up to 900,000 people have blood clots. Around 100,000 die from those blood clots. And that's in any given year with or without the vaccine. And so the EMA, again, the European Medicines Agency, the equivalent of our FDA, looked at the information. They have now said today, okay, we can restart these vaccinations because we don't think those vaccines are what contribute to the blood clots, although we're going to keep an eye on it. And you know the same thing here. The AstraZeneca vaccine looks like it's going to submit for its emergency use authorization to our FDA for here in the U.S. next month in April. And you know that both the VRBPAC, which is the advisory panel for the FDA, and the FDA are going to look at that data and particularly look at the blood clot risk. But one thing our FDA does is they make sure that the data comes from trials in the U.S. They might look at the other information, but they want information here. And so that's what they're waiting on right now. Hopefully they get that by April timeframe, and then we'll see about the emergency use authorization and how that's going to pan out. Could be a couple different things. One, they could give them an emergency use authorization. They could certainly say we want more information, so go back to AstraZeneca and say please supply us with more information. Or they could decline the emergency use authorization. They could go either way on this one, but time will tell with that. But that's where we are with that. Again, you've probably heard in the headlines that yes, about AstraZeneca being related to these blood clots, but by all indications and by the experts that I've read about and talked to, it doesn't look like there's a direct correlation. That they can't directly say that vaccines cause the blood clots, but they're certainly looking into it. But again, per AstraZeneca, 17 million people have gotten a shot, 37 have gotten blood clots after getting the vaccine. So the numbers to begin with, very, very low. Most likely these are the numbers that would have happened regardless of the vaccine that occur every year anyway around the world. So it's hard to directly involve the two, but they're looking into it. So those are the vaccines. The other thing I want to talk about is the CDC today just came out with some guidelines for school. And the guidelines address a variety of things. They address testing and how school testing should go on. They address outside of school activities, particularly sports, and what happens with sports, because we know that when it comes to school infections of spreading and catching coronavirus, that the numbers are very low. They tend to be lower than community numbers, except for when it comes to extracurricular type activities or sports type activities. And there they found out that those are where the numbers tend to pop up, especially for middle schoolers, even more so for high schoolers as they get older. More than likely it's because of the close contact between people, the not social distancing, not wearing masks necessarily. And so that is one of the big concerns they're addressing there. But the other thing, and this has been a big issue over the last couple of weeks, is up until now they have said 6 feet distance in the classrooms. Well, for some classrooms, especially in areas that don't have the resources, it's hard to do that and bring everybody back to school, or even bring a significant number of students back to school, because you have to set those desks 6 feet apart. You have to efficient right now, as long as everybody is masked. So here's their guidelines, and these are the guidelines they came out with. Number one, students, staff, faculty, teachers should all be masked. And by masks, they mean at least a cloth mask with 2 to 3 layers. You can certainly move up from there. You can certainly double mask, but at least that cloth mask with 2 to 3 layers. The other thing they're saying in classroom, and this is in classrooms, elementary school students should be at least 3 feet apart. Middle and high school students at least 3 feet apart, looking at the community though. If there's low, moderate, or substantial community transmission, but if there's high transmission, then they need to move back to 6 feet apart. On top of that, between adults, this is just for kids. 3 feet apart is just for school kids. They're still saying between adults, as in teachers and other adults in the building, they need to be 6 feet apart as well. If you can't wear masks, like when you're eating, you need to be 6 feet apart. And during activities where people exhale more, and the examples I give: singing, shouting, band, sports, exercise type activities, as in physical education, then you need to be 6 feet apart. And these activities should be outdoors in well-ventilated areas when possible. And then if you're in a common area, 6 feet apart as well. So what they're saying is 3 feet apart, if the transmission in the community is not high for middle and high schoolers, regardless of the transmission in the community, 3 feet apart for elementary school kids, as long as everyone is wearing masks. Teachers, students, everybody's wearing masks. Once they get outside of the classroom, then they go back to that 6 foot distance. Adults have to have 6 feet distance between them. Now, the big question I've been getting is, what does that mean for the rest of us? Well, right now, for the rest of us, it means exactly what we've been doing, which is the 6 foot distancing, the wearing masks, avoiding small groups. But the question comes in, well, what about when we go back to work? If we're wearing masks, does that mean we can distance 3 feet instead of 6 feet? And the answer is, at this point, no. But it certainly is something that might change here fairly quickly. When they did these studies, they did the studies looking at school children in the schoolroom environment. Now, the big difference there being, in a schoolroom environment, they have somebody who's watching them basically make sure they wear masks, versus if you go to your office building, that's not going to happen. If you're out in public, that's not going to happen. And that's one of the big things. Plus, we know the transmission profiles of children, especially as they get younger, are different than the transmission profiles of adults. And part of that has to do with their body size, the amount of volume of air that is exhalated, how far that goes, those types of situations. Even the height difference can cause some issues or some differences there. So between adults and children. So again, the studies looked at children classrooms, and that's where they're saying that 3 feet can work as long as they meet that criteria of everybody wearing masks and no high transmission of coronavirus in your community for middle schoolers and high schoolers. But everybody else needs to wear a mask, stay 6 feet apart, at least for now. If you notice, things are starting to loosen up a little bit as far as the guidelines. And a lot of that's because we're learning more about the virus as time goes on. And so now we know with vaccinations, the CDC has said, if you're vaccinated, you can have other people who are vaccinated over in small groups at your house, don't have to mask, social distance. If you're vaccinated and have family members who come from a single household who are not vaccinated, you can bring them over, don't need to mask or social distance. And now with schools, they're talking about 3 feet separation instead of 6 feet if you're masked, if there's not high transmission from middle schoolers and high schoolers. And that's going to open up some resources there because, again, some of these schools were not allowing children to come back because they couldn't maintain that 6 foot distance. Now, if they can maintain that 3 foot distance as well as masking, then they can go ahead and bring more students back in and still keep them safe. And that's the bottom line, to keep them safe, but to bring them back, because we know them not being in school is causing its own hardships, its own difficulties, and its own issues long term that we get concerned about. So we want to make sure we get them back as soon as we can. So again, going over the headlines, number one, vaccines. Our vaccine rates are going up. And they're going up very quickly, which is great. If you look at world statistics here, looking across the world, the vaccines themselves, USA, we're not number one, but we are if we look at vaccinations per 100 people, we are number 1, 2, 3, number 4. Chile, Israel, United Arab Emirates, and then us, United Kingdom's right behind us, in getting vaccines into our population by the population percentage, so not the vast volume of vaccines around the world or in your country. But we're also knowing that we're not that close to herd immunity yet, but we're getting closer. And hopefully over the next few months, we get more and more people vaccinated. And the hope is by the summertime, we get close to herd immunity and can start loosening up those restrictions even more. AstraZeneca, we talked about the blood clots there and how there's a very low number of blood clots. The risk would be very low, even if it was something that we released their advice to give the vaccine. And then we just talked about the 3 foot distance for classrooms, the CDC's new recommendations given criteria. So now let me see if you have any questions.
When will we have a good idea of how long the vaccines last?
So the question is, when will we have a good idea of how long these vaccines last? And the answer is, as time goes on. Right now, we're looking essentially at six-month increments. People essentially started getting the vaccine in January. And so they're going to look at July, August timeframe and say, okay, let's take a variety of things. One is the immune systems of people who got the vaccine. How are they doing antibody-wise? How are they doing reduced infection-wise? Then they'll look at the variants. How are the variants doing in the community? Because we know that variants can change to make the vaccine less effective. Luckily, they haven't changed that much yet, but it's possible that they could change to that point and we'd need boosters sooner. By all guesses, we're going to need a booster at some point, but the guesses go anywhere from 1 year to 3 years to 5 years. We just don't know. We won't know until time progresses and we'll find out real time. But be ready for boosters. Most people are saying it could be like the flu shot where we get it every year. Others are saying it could be 3 to 5 years like some of the other vaccines.
Is the vaccine safe for pregnant women?
Is the vaccine safe for pregnant women? The answer is we don't know because pregnant women were not in the human tests, the human trials, and the main reason not in human trials is because we want to make sure that, again, they're safe on adults first that are not pregnant, and then look at pregnant women, and then look at children as well. And so we start working through those other populations after we get through the healthy non-pregnant adults. But what they have said is, and this is certainly even ACOG's recommendation, which is the American College of Obstetrics and Gynecologists, that there's no indication that it wouldn't be safe. And so what you need to do is talk to your doctor about the risks of getting COVID versus the benefits of getting the vaccine, because you have to remember that COVID itself can cause some issues with both the mom to be, the fetus, the pregnancy, all those things. The COVID vaccine at this point doesn't look like it has any issues, but since it wasn't fully tested in the human trials, we can't say for sure. Although these vaccines, remember, they're vaccines that were done in increments of either 3 weeks apart or 4 weeks apart. And in the human trials, they did find a number of women who got pregnant in that interim and have had no issue with your doctor. Many pregnant women have been vaccinated, and many women who were pregnant got the vaccines. Many women who got the vaccines later found out they were pregnant when they got the vaccines and didn't know it at the time. And so far, no real indications that that's any health risk. But thank you for your questions. They've all been fantastic. And again, going over the headlines, number one, the vaccine, our rates are going up. We are doing well worldwide. AstraZeneca, the blood clot issue, the European Medicines Agency has said they're not as concerned with it, so they're going to go ahead and allow it to be used again, but keep monitoring it at this point. And then the CDC's recommendations, briefly, the main recommendation is that 3 foot of distance instead of 6 foot of distance if everyone in the classroom is wearing masks. But that 3 foot of distance cannot be used for middle or high school if there's high transmission of coronavirus in your community. That's 6 minutes as well, or 6 feet as well. Thank you very much for this. This has been fantastic. And as always, you guys have great questions. Hopefully this gives you some information going into the weekend. And like I say, the main goal here is to make sure you, your family, your loved ones, your community get through this pandemic sooner rather than later and as healthy and as happy as possible. Have a great weekend.
Are you a fan of our videos? Be sure to subscribe to Worldwide Campus News and Entertainment. Then ring the bell to see all notifications about the new videos and the latest video.